everybody, and welcome to this segment of the 2024 Race-A-Thon for World Autoimmune and Autoinflammatory Arthritis. I am so excited to introduce Yasmin, the Ocular Immunology and Uveitis Foundation, or OIUF for short. And I wanted to go ahead and give her the floor to introduce herself. So everybody welcome Yasmin.
Thank you, Leila. And like she said, my name is Yasmin. I'm the Community Engagement Coordinator at OIUF, and our mission as a whole is to support the patients, caregivers, and physicians of ocular inflammatory diseases like uveitis and scleritis. And a lot of times these conditions can be associated with other rheumatological conditions. So this is why we're definitely excited to be partnering today for World AiArthritis Day to make sure we're able to reach all of the people who may not have heard about us and could use some support from our end.
Definitely. And we're so thankful to have you all here for the second year in a row. So if all of you wanted to check in to see what the last segment that they had on the Race-A-Thon was, it was with Jay French and his daughter having to talk about her JIA story and also how it was as a parent to go through that. And I'll have the link in this video for you to be able to see that podcast. Super informative. That was an amazing resource for us to have last year. So I'll make sure that we can have the link to be able to replay that. And this year, we're going to learn a little bit more about OIUF and what they do. And I wanted to see if we can show everybody the link between AI arthritis diseases with the ocular immunology space so that we can see why you all are on this Race-A-Thon and what your resources can help our community with. So if you want to go ahead and maybe talk about how common uveitis is as like a comorbidity or a side effect of AI arthritis diseases.
Of course. So uveitis in general, as a whole, is a rare condition. However, within the world, about 40% of cases are thought to be associated with other autoimmune conditions. And just off the top of my head, some of the most common conditions that we see as comorbidities of uveitis are things like rheumatoid arthritis, juvenile idiopathic arthritis, Sjogren's, psoriatic arthritis, and axial spondyloarthropathy. And yeah, essentially, uveitis is an autoimmune condition as well, just autoimmune and autoinflammatory arthritis conditions. And what happens is that the body is mistakenly triggering an autoimmune attack against the tissues of the eye, and this can affect any part of the eye, and the prevalence of what parts are affected and the severity and things like that can be dependent on the entire picture of the whole patient, whether there are any other autoimmune conditions underlying, any risk factors, any genetics, and things like that.
Usually what would happen is if the underlying condition is not under control or not treated to the extent that it needs to be, then there's some room for the uveitis to develop. But even sometimes, even if the treatment plan is as effective as it can be, there can still be some development of this disease in their eyes and therefore causing uveitis. So that's the biggest thing, is that always keeping the underlying condition under control is the best way to prevent comorbidities. But sometimes we may be doing all we think we need, and we don't really know what to look for to see what there might be going on. That's the next thing that I wanted to ask you about, is the warning signs of developing uveitis. Like what are some big red flags that we can look out for to see if we are starting to develop those signs?
Absolutely. That's a wonderful question because, like I said, uveitis is very rare. And even when there are patients who are seeing rheumatologists regularly for systemic conditions, you might not always think of your eyes as being one of the things that can be affected. In general, things to look out for is if you notice any changes in your vision that aren't the way they usually are, anything like visual disturbances, like seeing floaters across your visions, lines, shadows. It can also manifest in redness or pain that you can physically feel and see along the eye, and then a general sense of light sensitivity. And now these symptoms just showing up may not necessarily mean that there is anything wrong, of course, but if you already do know that you are predisposed to autoimmune symptoms and conditions, it's definitely a good idea that if you do notice anything like this, it's better safe than sorry to have that checked out as soon as you can to make sure you're getting that addressed as early as possible.
And where would we get checked out for that? Is that like an ophthalmologist, an optometrist? Can they start to look for that, or would we ask our rheumatologist?
Absolutely. So a lot of times patients will have symptoms, but it's also possible to have inflammation that is asymptomatic. And that can be detected by an optometrist at a routine exam. When they're looking into your eyes, they would be able to see signs of inflammation. And ultimately, you would be referred to an ophthalmologist. And again, if you did choose to bring these symptoms up to a rheumatologist, if you happen to have a visit with them at the same time, because we all know how difficult it is to get them to see our doctors, you can always let them know and they'll be able to refer you to an ophthalmologist. And something that we focus on at our organization is erasing the deficit of properly trained ocular immunologists, which means physicians who are ophthalmologists who are specifically trained for autoimmune ocular conditions like uveitis. So you might end up seeing a regular ophthalmologist who might then refer you over to an ocular immunology specialist, and they'd be able to do a full workup to figure out what's going on.
That's awesome. I personally have never heard or seen anybody that was an ocular immunologist. So I wonder like how many there are in the country and if it's like rare to find them. I feel like I wonder if it's very scarce between all the big cities, or do you have any insight on that?
Of course, like I said, the mission of our organization is erasing the deficit, and part of that is understanding that there is a deficit of people who might not be familiar. It's such a rare condition, so people might not see cases of uveitis frequently, especially in cases that in towns that they're not seeing too many patients at once. And behind me actually is a wall of all of the ocular immunologists that we have trained here at OIUF. And we do also have a list of places throughout the country and throughout the world with ocular immunologists in the area, as well as the fellows that we have trained and where they're practicing to help patients find access to these types of physicians. But ultimately, an ophthalmologist would be able to detect that something is wrong. And the best thing might always be to check out your local ophthalmologist so they can give you the closest option. Because something that we dream to have in the future is a physician that's able to have comprehensive care with everything you need in one spot. And that currently is not as prevalent as it could be. So it's always good to start somewhere and be referred until you're able to get all of the physicians that you need.
That's awesome. I think that that's something that AI, like your organization, AiArthritis, have in common is just talking about the deficit, like you said, in rheumatologists and ocular immunologists. I'm sure that it's a little bit more rare for ocular immunologists, but there with rheumatologists, there's also a dramatic increase of people that need to be able to see a rheumatologist. Like we're hearing anywhere from 6 to 9 to 12 to even 18 months that it takes to get a new patient appointment in some parts of the US. And just if any of you out there know anybody who might be studying to be a doctor, whether it be an ophthalmologist or they're still looking at what they might be looking into, one of our biggest goals is to encourage those to look into rheumatology. It's often very overlooked when it comes to the med school curriculum. And so that's something that is a passion of AiArthritis, is to get to those younger generation to let them know that we really do need this type of doctors, along with the ocular immunologists and the rheumatologists. It's something to definitely look for. If you're into mystery and escape rooms and things like that, and you like a good challenge and a riddle, I think that rheumatology is a really cool field. So that might be something to think of as well in the future. Okay, that was a little bit of sidebar, but important sidebar. In terms of long-term concerns with developing uveitis, what are the most common long-term concerns? And just to give a full picture of what uveitis really consists of.
Absolutely. Like I mentioned previously, uveitis is when the immune system is attacking the eye, and this can manifest in multiple parts of the eye to create other types of ocular inflammatory disease. And the biggest thing and the most important thing that we are hoping to let everybody know is that early treatment is the key to preserving vision. As you may have possibly thought, uveitis can be vision threatening at times, but the biggest reason for that is a lack of proper care. And what that would look like is noticing signs of inflammation and either not being able to treat it properly or not going in to be seen right away. Because ultimately, patients are, if they're flaring or things like that, vision loss is something that's very common, but that is reversible if it is treated on time. The only way for things to be permanently damaged is prolonged inflammation that just isn't addressed, which is, I'm sure, similar to other rheumatological conditions. Yeah, one of the things that we try to focus on is making sure that people are treated as early as possible and as properly as possible. I'm sure you are fully aware of steroids and their use in terms of inflammation, how they can unfortunately have some unideal side effects at times. And one of the things that we do try to educate patients as well as physicians is that if we're aware that the patient has autoimmune conditions or risk factors for autoimmune activity and there's no infection or anything like that, the best way to stop the autoimmune activity is to address the root cause, which is the immune system with immunomodulators. And ophthalmologists in general are probably the last people to be using immunosuppressive medication. So it's possible to find ophthalmologists that aren't too familiar with these drugs. And for that reason, they're hesitant to use them. If you're feeling like steroids are not enough, if you keep flaring and if it's not sufficient to control your inflammation, that's a good time to look into finding a specialist or finding another ophthalmologist who is more comfortable, because although the immunosuppressives can have side effects as well, they are safe to use, they're widely used, and they have been proven to be one of the best ways to induce remission and keep your eyes quiet.
Definitely. And that's just something I was going to ask you too, is like the general steroids that we all are usually prescribed for our regular inflammation. Is that what's also used in uveitis, usually like prednisone?
Absolutely. Prednisone, systemic prednisone is given, but depending on where the inflammation is, how severe, and how significantly the flare is affecting the person, we give things like systemic prednisone. We also do prednisolone, which is prednisone eye drops, as well as in some cases, steroid injections into the eye to give a more localized reaction. And while these are very effective and they will take care of your flare right away, it's not something that you want to be using in the long term, because that autoinflammation is going to be continuing despite the steroids.
Definitely. Do you have any examples of the immunomodulating like medications that are usually given or that are very common? And then, yeah, are there any examples of those?
Of course. So one of the things that our founder and president, Dr. Foster, who is an ocular immunologist, has tried to put into practice throughout his career is something called a step-ladder approach to treating uveitis. And this is where we use a steroid-sparing technique only when necessary, and we introduce immunomodulators, increasing only if necessary, to avoid exposing people to things that they don't need to be on. So typically we start patients with things like methotrexate, Cellcept, other traditional global immunosuppressants, and one step up from that would be things like Humira. Humira is I think it's the only medication that is FDA approved for the use of uveitis. Everything else that we use is off-label, but we do things like Remicade, Actemra, all the way up to Rituxan if necessary. And again, we try to go up one step at a time so that people aren't on things as much as or as long as they need. But yeah, similar to what's used in rheumatology, we use the same
Definitely.
things in ophthalmology. And another thing to note when it comes to immunomodulators is that this is a point in the patient's care where collaboration with the rheumatologist is essential, because there might be situations where there are medications keeping your joints quiet, but your eyes aren't quiet, or vice versa. And you might get lucky and the same medication works for all of your symptoms. And of course, we don't want to be on too many different immunosuppressants from multiple people. So that's why the collaboration between the physicians is essential to making sure you're not being over medicated, but your symptoms are being addressed properly.
Definitely. And I just wanted to send up a flag because the step ladder approach as a like an actual practitioner and a doctor is going to be totally different than the issues that we might have that a lot of people hear about in step therapy, which is more
Mhm.
of the on the insurance side. So this kind of step ladder approach is totally different than what we would usually hear from step therapy because it's guided by the actual physician and by the doctor and not by the insurance company. So I just wanted to make sure that we separate those
Absolutely,
two because
absolutely.
that's a really big buzzword in our community because step therapy is good, like you said, to make sure that we're going on the right medication and we're not taking too much. But in the other side of the world, or on the other side of this part of the world, it's step therapy can be bad because we might know exactly what medication we
Mhm.
need to be on, but we can't because of the insurance part. So, but that
Absolutely.
is amazing to see, like how much of the like intertwining of the rheumatology side is with the ocular side, and that really it just shows like an example of how our diseases are so systemic that everything is just, a branch off of each other, and we use all the same medications. And that's like the big overarching like idea behind AI arthritis, because we are an umbrella disease. We have an umbrella of diseases. It's to show all of these similarities of these different diagnoses so that we can get early detection, early diagnosis, and early treatment, as so that, yeah, all of these are connected. And so I think that was a really good way to show our mission as well, and why we partner with you all and try to make sure that we elevate each other, because it is so important to make sure that you have both sides, both the rheumatology side and the ophthalmology side, and the collaboration like you were talking about. And like we said, with all of our different collaborations that we are hoping to have this year as well, what services does OIUF offer for those in the AI arthritis community, and how can they get involved?
Of course. So we have a website where you can access all of our resources. It's called uveitis.org, super simple. And like I mentioned at the beginning of this interview, we have resources for patients, caregivers, and physicians of ocular inflammatory disease. Something I would highlight is if you're a first-time patient hearing about just rheumatology in general or ocular inflammatory disease, we have some guides online that are extremely in-depth in explaining what is ocular inflammatory disease, what is inflammation in general, why are we using these medications, and just a breakdown of some terms that you might be hearing frequently at the doctors, and they might be a little too confusing to understand or to look up or something like that. And then beyond our guides, we have a lot of either virtual or in-person events and times where we like to gather the community together for support. We have events like our Crash Course Conference, where again, physicians, caregivers, and patients can travel to wherever we're holding it there to learn more about this condition and how to treat it all at once. And we also have some virtual support groups, both on Facebook and live on Zoom once a month. And our support group for the month of May is actually around the topic of asking a rheumatologist. We like to choose topics for our monthly support groups that are relevant to situations and things that come up in the lives of patients with ocular inflammatory disease. And a lot of times this can overlap with other conditions. A lot of the patients may have multiple comorbidities, or some of the information that we're sharing could be related to other conditions, whether you have uveitis or not. And we'll be sharing all of these resources with Leila, who can share them with you. And we're happy to have everyone who is interested to join us.
Thank you so much for being here today, Yasmin. It was so informative, and I think this is going to be a really great resource for both sides of the patients in the ocular immunology space and with the rheumatology/AI arthritis space. So I'm excited to make sure that we have this interview posted on YouTube so that we can both share it and make it a staple resource for our organization, so that we can have a little bit of an introduction to see like how we're tied in. I also wanted to thank Allison, the Director of Development and Programs, for setting up this interview so that we can make sure that we get the information out to the public. And I'm excited to be able to join in on your support group this month. And I hope that anybody else listening takes the time to register and go ahead, and we will put the link in the description below. It'll also be in our link tree if you want to take a look at that. Because AI arthritis does not offer support groups, we love to make sure that we highlight and let everybody know about the organizations that do hold support groups. And a lot of them are our partner organizations and our organizations that we're friends with. Please do check in and look into their resources, their support groups. From what I've heard, that they're super informative and a really safe space to be in. I'm looking forward to being a part of it this month. And what's the date and time of that support group this month?
Of course. So it's on May 23rd, virtually on Zoom at 7 p.m. Eastern Time.
Alrighty, so it's going to be 4 days from when you are currently watching this at the Race-A-Thon. Make sure to check the link to register for that. And thank you again, Yasmin, for being here.
Thank you very much for having me. We're hopeful that being able to share our resources will be able to reach some people who could use it.
Awesome. Okay, thank you.
Thank you.